regular thing. In Get Active, we're going to put on a bunch of different seminars for trainers and patients and anyone who's interested. At the end of the lecture, we've got a feedback sheet. If you've got any suggestions of things that you'd like to hear about, obviously today's about core stability, but if there's anything else that you're interested in, whether it's shoulders, lower backs, ankles, whatever it might be, jot on there what you're interested in, screening tests, whatever it might be, and we can prepare those for you. A few things about Get Active before I introduce Pete and we get underway. One of the things we offer to all the trainers that we work with is feel free to ring us anytime. So if you've got a client with a problem and you've got a few questions, feel free to ring us on our normal line, 1300 and just see who's around and ask to speak to one of us. We're happy to help you out with whatever it might be. Often you can just give me a few tips over the phone, or if it sounds more serious, you might recommend that they come in. Another thing, if you do refer someone to see us, we reward you with a free 30-minute massage. We also offer free 10-minute pain and injury assessments to any of your clients or yourself. So they can come in, or you can come in for free, quick chat, and we can provide you with some advice on what's the best way to proceed from there. Just to be clear though, it's only if your referral converts from that to an initial consult that you get a reward. That'll make sense. We also do free computer foot analysis. So anyone with shin splints, knee problems, hip problems, things with running or foot pain, feel free to ring up and book in for those. They're free as well. We also invite you to sit in on your client sessions. So if you send someone to see us and they've got a problem, we invite you, obviously with the patient's consent, to sit in on the session, learn about the condition, learn about the rehab, and then you guys can take charge of the rehab from there. And it's a real way to develop your skills and you'll identify that problem time and time again in your career and you'll know how to deal with it. Like I mentioned, we want to do more of these lectures and some in-service and potentially some more practical things as well. The other thing we can do is we can sell you guys massage 10 packs. So if you buy a 10-pack massage at a reduced rate, you can package them and on-sell them to your clients or put them in 10 packs or whatever it might be. And I believe that's enough for the girls and it's expensive for you guys. So welcome, and hopefully we can have more and more of these and be seeing you all more and more. So I'll just introduce Pete. Pete is our new star recruit at Get Active. He's got a pretty long list of academic qualifications here. He started with a Bachelor of Sports Science. He's got a postgraduate diploma in sports medicine and a Masters in Physio. He initially ran his own personal training business, for 3 years. And he worked as a rehabilitation program coordinator for the Back Institute in New Zealand, which is an internationally renowned multidisciplinary rehab company with over 140 clinics worldwide. Peter was fortunate enough to work alongside and learn from some of the leading orthopaedic surgeons, physios, OTs and psychologists in the field of injury rehab, including Dr. Hamilton Hall. To add to Peter's academic achievements, he's played national and international soccer, New South Wales Premier Grade AFL and regional cricket. Before we get started, just a special thank you to AOK who sponsored the lecture for us today. So the first 20 registered get the free foam rollers. If any of you are interested in AOK's products, you can pick them up online at our site at getactivephysio.com.au and just go to the product store. There'll also be a brochure handout with all the rest of the AOK products if any of you are interested. So with that, I'd like to introduce Peter Halstead.
Thank you, Brendan. Thanks for coming on, guys. 2023 foam rollers, no brainer, come along, first in. That'll be a winner just to start off. Today what we're going to look at is in unit core stability. Core stability is an area that's had a lot of press over the past 10 years. There's a lot of myths out there with core stability. We'll talk about your inner unit, so your deep muscles around your spine and your pelvis. It's an area I think gets missed a lot with a lot of trainers and therapists around. So just going to clear a few things up with that. Feel free to fire any questions as we go. We might be asking for a couple of volunteers as well. All right. So we're just going to talk about why is core stability important. Talking about the inner unit in particular. Look at some anatomy and physiology behind it. Cover a couple of research articles that have gone on in the past few years about core stability. And we'll do a bit of a practical session at the end. We'll get someone up. I'll show you how I teach inner unit core stability, and we'll give you a break off into gears if we've got time and have a bit of a try on each other. Okay. So in terms of why it's important, back pain is a huge issue in Australia and around the world. 80% of people in Australia who get back pain at some point in their life. The reoccurrence rate within 12 months is as high as 80%, which is pretty huge. The direct costs are up to $1 billion. That's a 2004 statistic in Australia alone, which is pretty huge. Indirect costs up to $8 billion, which include off work type of thing. There's heaps of workers' compensation cases that go on and on for back injuries. Okay. In terms of related to personal trainers, can be a common reason, lower back and lower limb injury, where people are cancelling their sessions. They might flag their trainer because they've got injured during the training sessions. Okay. So in terms of specifically for trainers, I know there's a few gym members out there as well. Most of you trainers here. How many trainers have had your clients have injuries? Back injuries, lower limb injuries. So it's pretty huge. When they have injuries, they're not going to be able to train as hard and achieve their goals. Okay. If they've got poor inner unit core stability, they have that increased injury risk. Okay. They won't achieve their goals. They're going to have less retention with your clients and decreased revenue. And if you injure them doing exercises when you're training with them, you're occasionally going to be at a legal liability to these clients. Okay. So what can core stability do? All right, a few optimal inner unit core stability. All right, so it can decrease your risk of lower back pain recurrence and lower limb injury. We'll look at some studies shortly that go into that. Improve your balance. A lot of your balance centers in your body come around your pelvis and your spine, as well as your ankles. In terms of muscle tone, yes, you've got your outer core unit, your outer big muscles, which look nice and pretty at the beach. Your inner unit, particularly your transverse abdominis across the front, can also add to that flat stomach type of look if you build that up. When you're looking at sports performance, whether it directly impacts on sports performance is a little bit up for debate, but if it allows you to train and have less injuries, if you've got a good inner unit core stability, then you're likely to train more often and achieve your goals quicker. Okay? So it has an indirect effect sometimes. Also can improve continence, all right? So your pelvic floor muscles, they play a key role in your core stability, all right? Pelvic floor muscles control your bladder movements, all right? Especially post-pregnancy. There's good evidence that having good pelvic floor muscles can decrease your risk of incontinence problems by up to 50%. In terms of specific research examples, this is a study that looked at low back pain patients that had had an episode within 3 months that had the episode. Group 1, which is in the blue, they went through some treatment that generally consisted of some advice and some medication, okay? And group 2, which is in the red, they did specific core strengthening exercises for 8 weeks.